Well, let's turn our attention to this now and take a look at the state of public health in the country. The Department of Health, along with the World Health Organization, held a seminar to explore ways of enhancing efforts to build a resilient health system. Professor Alex van der Heever is from the Wits School of Governance. He joins me. Good evening, Prof. Thank you so much for your time. An important conversation, as we know the country is going full steam ahead with plans to implement a national health insurance. I don't think there are questions over whether we need universal access to healthcare, but really, how do we make that come alive with the scenarios that we're faced with?
Well, the question that sort of strikes one with the national health insurance proposals is that they appear largely to be a distraction from addressing the real requirements for implementing universal health coverage in South Africa. We have two very large systems, a public and a private one, and they require intensive sort of legislative and supervisory sort of treatment, and neither is happening in both. And so this is a problem in that what appears to be happening is that there is kind of a political noise being created around a policy proposal that is quite unlikely to be implemented, while they're doing absolutely nothing about managing these two big systems. And as a consequence, our universal coverage and access to healthcare is actually deteriorating on both fronts.
Where do you think the greatest difficulties lie here, Professor van der Heever? Because, again, the more that one looks at the conversation, you'll have the private sector that says, well, we're not being accommodated, we're not part of this conversation, as then proposals for policy changes are being made. And government will say, you know, the private sector is not really open to exploring the full possibilities of what universal health care could look like in this country.
Yes, I wouldn't know where the National Department or government at the moment on healthcare reform is, you know, who it's even engaging with, because it's not about the public sector, the private sector. It's about ordinary citizens and what people need on the ground, whether they're on a medical scheme or whether they're accessing a provincial health department. They appear to be completely irrelevant to the discussion. And presuming that discussions with the private sector or anybody else or the important discussion is in itself an evasion. Government basically needs to focus on solving real problems in the health system. So in the case of the public system, the fundamental problem at the moment is a leadership one that results from structural weaknesses in the way in which the governance architecture has been set up. So it essentially ends up with people in leadership positions within provinces who are basically crooks and completely incapable of performing their functions. This is now causing a systematic failure of the provincial health system. It's not about resources, and this is well known. It's not about not having enough doctors and nurses and money. It's about the productivity of the system that can't function if leadership is basically dysfunctional. And in the private sector, the regulatory reforms that are required were identified in the health market inquiry in detail, together with evidence that actually justified the interventions that were required. That report was produced in 2019, and the National Department of Health has done absolutely nothing. And it appears they don't even understand or haven't even read the report. So this is the problem that we're dealing with, is that government talks about universal health coverage, but actually doesn't do anything in reality, and pretends it's just some sort of standoff with the private sector. That is absolute nonsense. They're just not doing their job. And it's a question as to whether or not they're actually capable of doing it.
And in the meantime, of course, you know, the private sector then also gets away with the narrative that it's providing a much better service or even a flawless service to its members and those who are able to afford access to private healthcare, which that market inquiry showed was in fact not the case.
So the market inquiry identified significant systemic problems, but it said that the problems can't actually be solved by the market operating on its own. It said that there needed to be certain regulatory changes and interventions. So that is well known. This is well known around the world because there are many systems that operate as regulated markets. And what's required to stabilize our private sector are those interventions. So that was very, very clearly laid out. The problem that's occurred is that the national government has basically taken the position that as far as they're concerned, well, the private sector won't exist in the future, so we won't bother to regulate it properly. That is just an insanely, if not moronic, position to take on extremely complex health systems. It shows that there is just no understanding of what's going on. And this applies also to the public sector. So it's not about public versus private. Many people in the private sector, to me, that I've engaged with directly, who would be technically harmed by the regulatory reform, accept that there is a need for this reform, this change in the system to help the system work better. But they themselves, as individual parties, can't take it forward. It requires an active government working together with society. And the provincial health system, and it's important to note that equivalents to our provincial health system exist all over the world as very successful models. But we have a model in which we've allowed political appointments into the system. And that has resulted in systemic patronage. It has resulted in a collapse of the provincial health system. So if in Australia they did the same thing as we did, their system would also collapse. But they have a provincial system too. They have a state-level system. It's all over the world. And regulated medical scheme markets also exist. They're the predominant model in many respects in many countries in the OECD. So we know how to regulate these systems. But what we're finding at this stage, many of us looking at the way government is proceeding at the moment, is that they just ignore all the evidence on what is required to reform and merely want to talk about universal health coverage as if they're the only ones pushing it. But they absolutely do not back up any of their verbiage with something real.
All right. Well, one certainly can think of a hospital like Tembisa Hospital, right? When we talk about how some of these health institutions have been used to basically feed the networks of patronage. Professor Alex van der Heever will leave it there for tonight.